Hi, my name is George. I'm a surgical registrar and researcher at the Austin Health Hospital and Doherty Institute in Melbourne. So, in recent times in Melbourne, unfortunately, as a result of increasing community transmission of COVID-19 and in light of new evidence which supports airborne spread of COVID, we are now being recommended to wear face masks in public places, such as the supermarket, where we can't socially isolate. And in the last few days, I've had quite a few questions from friends as well as colleagues in the lab about how to correctly wear masks and apply them. So I thought I would make a short video aimed at non-medical professionals to explain a little bit about masks and how to use them. So there are various masks in circulation at the moment. This is probably the most common one that I've seen, but other masks that you might see can look a little bit like this. They come in various different colours, like this one is orange, some of them are green, some have a visor attached, some don't. So just a couple of things to point out about masks is that they have a top and a bottom, and you can distinguish the top by finding this metal rim, which is to fit snugly around your nose. The bottom of the mask does not have any metal, it's just made of paper. The other thing to know is that masks have an outside and an inside. And the outside surface is usually indicated by the colour, in this case blue, in this case orange, again sometimes green. And in this case the outside is indicated by a cute teddy bear pattern. In all cases, the inside of the mask is much paler, usually white. So before you put your mask on, just a couple of things. I'd recommend actually popping them on at home before you leave the house, because it's much more comfortable, a bit less stressful, and also you've probably got a mirror at home and they're much easier to pop on in front of the mirror. But before you put your mask on, just in case you've got any germs or nasties on your hands, and we're going to be putting our hands close to our face, it's very important that you wash your hands. So I'm just going to use some alcohol gel. Wash my hands, and then we can pick up our mask. So firstly, you want to make sure that your mask is orientated correctly. So we've got the metal ring at the top, we've got the outside surface facing away from us. So we use that metal strip to fit the mask snugly around our face. We grab the elasticated bands and pop those behind our ears. Now by squeezing tightly around our nose, we can gently pull the mask around our chin, and that gives us excellent coverage of our face. Now, if you're a glasses wearer like me, to reduce fogging, it's really important that you get a good seal around your nose, and you can apply a little bit of tape there to improve that. That reduces the flow of air upwards and encourages the flow of air out the back of the mask, which is what these masks are designed for. So once the mask is on, it's really important that we don't touch the mask, particularly the outside blue area, because that's where any germs or potentially COVID-19 is going to collect. So once it's on, make a conscious effort not to touch your face or the mask. And when you come to taking the mask off, it's very important to maintain that as well. So when we take the mask off, we just want to touch the straps and take it off carefully, and just hang the mask in our hands by the elasticated bands and pop it straight in the rubbish bin. And that way we're going to reduce any risk of contaminating ourselves or any objects in our home with any germs that are on the mask. And then once the mask is removed, we should again wash our hands in case we have accidentally contaminated our hands with any germs that have been on the mask. And then we can sort of relax and get on with our day. Now just a quick word about the other types of masks. They're essentially the same. They've got the metal rim at the top that fits closely around our nose. They just tie in a bow instead of having the elasticated bands. And when you take those off, undo the bow, carry the mask by the string, and again I'd recommend you pop that straight in the rubbish bin to avoid any contamination. So one final thing to point out about those masks is these are paper masks. They're designed for single use only. So it's very important that when you've finished with them, they do go in the waste bin. You wash your hands, and if you go out again, you should try to access a new mask. So good luck, stay well and safe, and I hope that video helps you putting on your masks correctly. Okay, thank you.